Welcome, everyone, to Clearinghouse Review and Clearinghouse Review's annual special issue webinar. Today, we'll be considering whether the local food movement helps or hurts low-income Americans. Between the Farm Bill and Mayor Michael Bloomberg's proposed soda rules in New York City, this topic is in the news every day, and we're thrilled that you are all here to discuss it with us. I'm going to say a quick few words about Clearinghouse Review and the Shriver Center before introducing our moderator and panelists. For 45 years, Clearinghouse Review has been one of the nation's premier resources for legal aid attorneys and others working on behalf of low-income people in the United States. With an estimated readership of nearly 9,000 people, the bi-monthly review, published in print and online, is a vital tool for all kinds of advocates representing the poor in civil and social policy matters. Every year, Clearinghouse Review publishes a special issue on an important topic. This year's special issue, Hunger in the Land of Plenty, Food Insecurity in America, will be published in October. Clearinghouse Review is part of the Chicago-based Sargent Shriver National Center on Poverty Law. The Shriver Center provides national leadership in advancing laws and policies that improve the lives and opportunities of people living in poverty. The Shriver Center engages in direct advocacy campaigns in Illinois and around the country, and also engages in broader advocacy on general issues of justice, opportunity, and human rights. A few technical points before we begin. If you're having technical problems, please email Clearinghouse Review's Kathy Donahue McNally at kathleenDonahue@povertylaw.org. If you're unable to resolve your technical problems, don't worry. Everyone will be emailed a link to a recording of today's webinar and will be also available on our YouTube channel. If you have questions for our panelists, you can submit them using the question box on your screen. Today, we're lucky to have an illustrious group of scholars and practitioners with us to flesh out the intersection between local food and food insecurity. Our panel's full biographies are available on the webinar's resource page, so I will keep my introductions brief. Professor Susan Schneider is director of the LLM program in Agricultural and Food Law at the University of Arkansas School of Law. In addition to being a professor and author, Professor Schneider is a major player in the online universe, where she's an active blogger and has an amazing Twitter account. Jessica Bartholow is a legislative advocate at California's Western Center on Law and Poverty. She's a leading anti-hunger voice in the current struggles surrounding federal reauthorization of the Supplemental Nutrition Assistance Program, or SNAP. Emily Broad-Lees is a senior clinical fellow at Harvard Law School's Center for Health Law and Policy Innovation, and also directs the center's Food Law and Policy program. Emily may be based in Cambridge, but her work frequently takes her to farmers markets and food policy councils all over the Mississippi Delta. Dan Lesser is the Director of Economic Justice at the Shriver Center, where he has worked on ways to increase SNAP recipients' access to fresh food without limiting their choices, including Illinois' successful administrative advocacy campaign spreading out the issuance of SNAP benefits over several different days of the month. Valerie McWilliams is a senior supervisory attorney at the Land of Lincoln Legal Assistance Foundation. She specializes in health-related cases and community development projects and has helped kickstart a farmer's market in a low-income neighborhood, as well as a neighborhood farm focused on youth education and employment. And my name is Michelle Host. I'm an editor at Clearinghouse Review, Journal of Law and Policy. So now, having introduced our panelists, I'll turn the webinar over to Professor Schneider.
Thank you, Michelle. It's truly my honor to moderate this webinar. I've been a supporter of the work of the Shriver Center and Clearinghouse Review for a long time, and we have a particularly impressive group of panelists that I'm anxious to hear from today. I'd like to start out, though, with framing our discussion a little bit. The local food movement means different things to different people. There's not even a uniform definition of exactly what we mean by the term local. But at its core, the local food movement calls really for a connection between people and the food they eat. What do I mean by this? What kind of connection are we talking about? Well, by connection, I mean an understanding about where your food comes from and an understanding about what the food is that you're eating. where it's from, and what it is. Presumably, this connection is best made if the food comes from a local, tangible source that the consumer can know and understand. This connection might involve a connection with the actual farmer that produced the food that we eat. This is best exemplified probably by a farmer's market in the local community. This connection is the heart of the Know Your Farmer, Know Your Food program that's been pioneered by the Obama administration at the USDA. But the connection might actually also involve active participation in producing food yourself. This could be through individual gardening, or it could be through a host of the community gardening efforts that are springing up all over the country. Consider the phenomenal effects of the efforts of organizations like Growing Power in Milwaukee, where a low-income community has a source of local food through the Growing Power gardens, or the conversion of abandoned property to a community garden, an inner-city edible space. Or it might even be a community-sponsored agriculture system where farmers outside of the city produce food and deliver what they've produced to the community. But the local food movement really cannot be fully understood without considering the type of change that it calls for. The current reality of our food system is that it's based on a corporate, industrialized model. It may be virtually impossible for you to actually determine where the food you purchase from the store has come from, because it's probably been sourced from all over the world, and it may have been manufactured by a number of different corporate entities. And in some cases, it might be so highly processed that it may be extremely difficult for you to know exactly what it is you're even eating. The local food movement presents a dramatic contrast. Proponents promise that this local food will provide more nutritious food, produce better individual eating habits, and strengthen local economies. But how do all of these issues affect those who struggle to put food of any sort on the table for their families? Where's the connection between the local food movement and the low-income community? Jessica, I'd like to start out by asking you a question. You've worked with food banks in California, with food stamp advocates, and you're actively involved in the efforts to protect the SNAP benefits in the current Farm Bill discussion. Do low-income Americans receive any of the potential benefits from the local food movement?
Hi, this is Jessica. Can you hear me?
Yes.
Great. Thanks for having me, and thanks for the question. Well, you know, I think that we need to think about the local food movement and its relationship to low-income people in a broad historical and current-day context. When we think about the local food movement, when they originate from communities that do lack access to food, and when they do offer a place and the topics for low-income people to become engaged and organized in addressing injustices and inequalities that impact them, I think that we can only see good things come from that. We need to think historically about food and food access issues and how they've always been part of social justice and economic justice movements. Here in California with the farm laborers, they always used food as a way to organize and bring people together, both with dinners and groceries distributed at charlas and meetings that they had. We can't overlook the historical context of the civil rights movement and how people were organized and inspired by the fight to be able to sit at the same lunch counter. Food is an important part of how we come together as communities, how we talk about, you know, and recently how we talk about injustice and inequality. This is because food is an important part of how we define our communities, how we define our cultures, our values, and broader economic rights. For these reasons, food literacy and empowerment can only contribute to the tools that low-income people have to help improve their health and reduce health inequalities and disparities. But I think one thing we really want to highlight is that there is a real danger when these dialogues are focused only on food and food itself, rather than the broader context of economic injustice, inequality, where people live, their access to housing, their access to transportation, their access to jobs. And I also think there is a real danger when these conversations that are solely focused on food and trying to find solutions to lack of access to food and healthy food and local food miss the point about how fragile the food safety net is for low-income Americans, and how policy changes, either at the local municipal level or at the state level or at the federal level, can really negatively impact people's access to food and impact the food safety net. Over the past year, many of us have been involved in sometimes passive, sometimes not so passive, dialogue about the role of anti-hunger programs in contributing to obesity and food-related diseases, as well as other health inequalities. And Western Center has taken a very strong position, along with other national partners at the Food Research and Action Center, the Center on Budget and Policy Priorities, and the Shriver Center, in making sure that people understand that the SNAP program, the food stamp program, it is about subsidizing the budgets of low-income people. Some have argued that the program, if low-income people spend those dollars on food that isn't local or that isn't seen as healthy, it is subsidizing those foods or those industries. But this approach we feel to be very condescending and dismissive of the low-income people who benefit from the program. It shouldn't be a debate about whether or not these monies are subsidizing industries. Monies that go to low-income people from the SNAP program subsidize only the choice of those families. To sum up, we just want to point out that in order to have a healthy approach to ending diet-related diseases in the U.S. and increasing health access, or access to food, access to local food, or food in general, we need to remember the best approach is by increasing people's access to choices, not removing them. There aren't public health solutions to any problems facing low-income Americans that are going to be solved by reducing the opportunities and choices that low-income Americans have.
Thank you, Jessica. Some very good and interesting points there. You specifically talked a bit about access to foods. Emily, your work has specifically focused on increasing the access to healthy local foods and assisting local producers in participating in farmers market. Some of that work has involved the food system in the low-income communities of the Mississippi Delta. How does the concept of a local food system relate to healthy eating, and how does this relate to hunger and food security in your experience?
Hi, this is Emily, just to make sure you can hear me.
Yes, it's great.
Okay. So I think one of the, Susan, you have it right on that we've really worked at the intersection of really access on the consumer side, and then also breaking down some of the barriers to producers who are part of the local food movement. And I think to us, we really look at the local food movement as a, kind of a heading that includes just all types of alternatives to the kind of global industrial larger food system. So in the sense of producing alternatives, I think our goal is to help these alternatives that right now might be smaller, might be more expensive because they don't have the same economies of scale and they're not able to sell in as big of a market. But if we can support those kinds of food systems now, then the hope is that over time they will be more affordable and more available for all people, which is, again, the goal is for everyone to be able to have access to healthy foods and the foods that they need to have a healthy lifestyle and reduce, all the kind of bad things that go along with food insecurity. So I think again, we're hoping that if we break down some of these barriers that make it costly or difficult or sometimes impossible for small food producers and local food producers to sell their goods, then over time they'll be able to do this and it will be equally affordable for all people. I think the other thing that we really need as part of the local food movement is a real localization in terms of the addressing food system issues. So there's been a real move from addressing all these issues at the federal level, while there is obviously huge federal implications for things like the Farm Bill and these federal food assistance programs. But we've seen a big move to people making more policy decisions at the state and local level. And I think that's really another side of this local food movement. And when we make these decisions at the state and local level, it means that there's a lot more opportunity for citizens to get involved through things like state and local food policy councils, which are often the kind of main community that we serve. And we've seen that these food policy councils are really making attempts to bring together the people, the voices of growers and producers and urban and community gardeners and et cetera, with some of the voices around food justice, economic justice, environmental justice, and hunger and food insecurity. So to the extent that we can continue to support those movements of bringing these voices together and trying to marry the efforts around the local food system with efforts to increase the availability and affordability and access of food for people that are in hunger or food insecure, then we can find these solutions that really benefit both sides. And I think finally, if we think about some of the root causes of hunger and poverty, it's really people who don't have jobs or can't find employment that can support them. Part of it's because of tough economic times, but at any time we have a certain percentage of the population that is unable to make enough to make ends meet and be able to purchase their food. And I think that what we've seen is in a lot of these local food systems, there's a lot more opportunity for employment and economic development that is taken away at the kind of global, national or international industrial food system level, where typically the big farms, big equipment, big machinery, they actually don't employ that many people. So if we can find ways to integrate some of the people who might be in poverty or in hunger, food insecure, into these local food systems and match them with some of the new job opportunities and economic development opportunities, then hopefully we can really start to chip away at some of the real base of this problem in the first place. So I think those are really, to me, they're sort of two sides of the same coin, the issue of kind of trying to find a space for local food systems and alternative food systems, and then also trying to make sure that everyone has enough and healthy and the right kinds of food to eat to support a healthy lifestyle. And our center really, we provide kind of legal and policy technical assistance to a lot of these food policy councils, farmers markets, food organizations, but then also to sort of state governments really around how they implement their SNAP program and their WIC program and their school lunch program to make sure that they're really maximizing those benefits, and also, where possible, linking the two together so that everyone is sort of benefiting.
Great, thank you, Emily. Those are also very interesting points for us on our discussion. Dan, you've been a leader for years in the Shriver Center's efforts to protect public benefits and promote economic security. An important objective of the local food movement is to promote healthier eating. What should be done to provide SNAP participants with greater access to nutritious foods, especially fresh fruit and vegetables?
Thanks, Susan. There are three issues I'd like to address in response to your question. These issues are: one, spreading out the dates of the month when SNAP benefits are issued; two, providing financial incentives to use SNAP benefits to purchase fruit and vegetables; and three, whether SNAP participants should be banned from using their benefits to purchase non-nutritious foods. The first issue was brought to our attention by the Illinois Retail Merchants Association and the Illinois Independent Grocers Association, powerful business associations with whom we had not previously worked. At the time, Illinois was issuing benefits to 70% of all SNAP participants on the first day of the month. This had several negative consequences, including long lines at grocery stores on the first of the month, food pantries running out of food towards the end of the month when demand was greater, and limiting SNAP participants' access to fresh fruit and vegetables. grocers could not meet the high demand at the start of the month and had fresh fruit and vegetables rotting on the shelves later in the month. A coalition of business interests, anti-hunger advocates, and food pantry associations joined forces and through administrative advocacy persuaded the Illinois State Agency to spread out its SNAP issuances over the first 10 days of the month. We were not able to spread them out more because federal law prohibits participants from having to wait more than 40 days between issuances. There are 9 states that issue all SNAP benefits on the same day of the month, and 7 more that spread out their issuances over 5 days or less. SNAP participants in all of these states would benefit if issuances were spread out over 10 days. The second issue is increasing SNAP participants' consumption of fruit and vegetables by providing financial incentives. There have been a lot of small-scale local initiatives that provide financial incentives to SNAP participants who use their benefits to purchase fresh fruit and vegetables. These typically involve purchases made at farmers markets or that otherwise relate to the purchase of local produce. The USDA is currently funding a major pilot project in Hampton County, Massachusetts, a geographically diverse county in the western part of the state. Called the Healthy Incentives Pilot, it is designed to assess the impact of providing financial incentives to SNAP participants. Participating households will have 30 cents added to their benefit balance for every SNAP dollar they spend on fruit or vegetables. Fresh, frozen, canned, or dried fruit and vegetables will qualify for the bonus, but vegetables or fruit with added sugar, salt, fat, or oil will not. The project is being rigorously evaluated by apt associates who will focus on whether this financial incentive increases the consumption of fruit and vegetables by SNAP participants and how participants' overall diets are affected. apt will also assess the impact of the program on retailers, the state, and other affected parties and assess the feasibility of expanding the program nationwide. The pilot is continuing through this calendar year with evaluation results expected in 2013. The third issue, the one you've been waiting for, is the controversial proposals that seek to increase the use of SNAP benefits to purchase nutritious food by banning them from being used to purchase non-nutritious food. Proponents of restricting SNAP participants' food choice recently suffered a setback when the Food and Nutrition Service denied New York's waiver request to bar the use of SNAP benefits to buy sugar-sweetened beverages. Nevertheless, the issue of restricting SNAP participants' food choice remains a hot topic of increasingly acrimonious debate. It's also a topic that has produced especially strange bedfellows. On the side of restricting food choice are Tea Partiers and other conservatives, joined by many public health advocates. On the side of not restricting food choice are anti-hunger advocates in the beverage industry. Senators DeMint and Wyden both had proposed amendments to the Farm Bill currently under consideration in the Senate that pertain to this issue, but neither is among the 73 amendments being considered. The Shriver Center is opposed to placing restrictions on what food SNAP participants may purchase with their SNAP benefits. The 4 reasons we have taken this position are: 1, the lack of a clear and practical means to determine product eligibility, which is essential to avoid retailer confusion at the point of sale and stigma for clients. There would simply be no easy way to distinguish between what products may or may not be purchased, as there is now. SNAP participants, including the blind, illiterate, or English language learners, would have to read product labels, or grocers would have to mark or segregate banned products, stigmatizing participants. In either case, there would be confusion and anger at the checkout counter that would affect all shoppers. 2, the adverse impact on retailers. Implementing a ban would be especially complicated and costly for retailers who don't use UPC codes or modern scanning equipment. These and other burdens could cause some retailers to drop out of the SNAP program, reducing participants' access to nutritious foods. 3, SNAP recipients should not be singled out. According to research, SNAP participants are no more likely to purchase non-nutritious food than other people. We must change our eating habits society-wide and not single out those in need. And 4, and last, we should pursue incentive-based solutions to the obesity epidemic. In addition to financial incentives to purchase fruit and vegetables, 2 other positive alternatives that would significantly increase the consumption of nutritious foods by SNAP participants are: 1, addressing the problem of food deserts in low-income neighborhoods, and 2, increasing awareness through nutrition education that gives SNAP participants the tools to make healthy choices.
Thank you, Dan. 3 very important elements of our discussion here. I'd now like to ask Valerie a question. Valerie, in your work in Illinois, you've been involved in health and in community development projects involving local food initiatives, such as farmers markets and urban farming. What do you see local food efforts impact in local income communities? Local foods are a good concept, but what does it really have to do with the legal aid practice?
Well, I think there's two parts to that question, at least two parts. One is, how does this fit in with legal aid priorities and core values? And the other one is, what's the role of a lawyer in advancing these efforts? In legal aid core values, I think every lead organization is going to have a mission of wanting to promote health, promote neighborhood preservation, and fighting poverty. And a traditional way to think about that would be, for example, if you promote health by helping people get Medicaid eligibility or have SNAP eligibility. Under my approach to these issues, I think we need to have a more expansive view of how we address that critical issue. And so not just thinking about how do we increase the number of people that have SNAP benefits, but asking the question of where can they use those benefits and how can they be used. When we think about helping people get Medicaid eligibility, maybe we should also be thinking about issues of improved health outcomes and not just Medicaid, which is a mechanism for paying for services for people who are already sick. Similarly, with neighborhood preservation, I think there's a fair amount of resources right now going into foreclosure prevention and those types of issues. But a more expansive view about impact of legal aid lawyers in a neighborhood would be, how can we be assisting neighborhood groups as they seek for opportunity for increased jobs and increased access to local food and whatever it is that a neighborhood association has defined as their goals for the neighborhood. Similarly, usually in a legal aid organization, when we think of fighting poverty, at the top of that list is helping people get disability benefits, helping people access TANF benefits, income maintenance kinds of issues. But as has already been discussed today, a critical issue in low-income communities is access to jobs. And the local foods movement really does provide at least glimmers of hope on a local level to increase access to jobs and also workforce development opportunities. So why is it important for lawyers to be involved in this as opposed to like people who know how to farm or grow things or raise tilapia? Well, it turns out urban farming is very complex, and there's a lot of transactional work that needs to be done, starting with in helping organizations incorporate, and for those that are farming as a nonprofit to achieve those nonprofit benefits at the various levels of government. But also risk management is a huge issue. In all these operations, even in small community gardens, usually there's going to have to be issues of insurance dealt with. There are going to be contracts, negotiations with cities, land use issues, zoning issues, licenses, and also when it comes to food, there is a tremendous amount of regulatory compliance that's involved, whether it's just growing vegetables or especially if you get into the processing of food. It's likely that a grower is going to be dealing with the EPA, with the U.S. Department of Agriculture, the State Department of Agriculture, the Food and Drug Administration, and also a huge issue, sometimes as an obstacle, is departments of public health at the state level and at the county level. So there's a lot of opportunities where the specialized knowledge that lawyers can bring to bear are helpful in this context.
Thank you, Valerie. Those are some great points for us. While our panelists have been speaking here, we've been getting some phenomenal questions in from our audience. And I'd like to turn to some of those now and carry the discussion a little bit further. Jessica, shortly after you spoke, a question came in right away for you about the connections that you were talking about between the local food movement and the anti-poverty issues, and how local food people needed to recognize the anti-poverty issues that may be confronting communities. Our questionnaire asked if, or made the suggestion that the anti-hunger movement also needed to connect with the local food movement using the examples of food banks and reaching out to local food connections in the communities. The question then was raised, why are both groups missing the boat in terms of working together?
Thank you for the question. I'd like to speak from my own experience in the anti-hunger movement for 12 years, working with food banks here in California and also within the Western region. It's not our experience at all that food banks have been absent from the anti-poverty conversation. In fact, I started my own work with food banks in New Mexico, helping to register people to vote and helping people to learn about their rights during welfare reform. And came out here in California, where I joined the Alameda County Community Food Bank, which is one of the strongest leaders in our anti-poverty movement here in California. The food banks in California, you see the anti-hunger advocates in Oregon are leading the fight to save TANF. In the Western region, we have a Western Region Anti-Hunger Consortium, where our leader is somebody who works for a childhood organization focused on poverty. Nationally, I think our anti-hunger advocates are very much in touch with the anti-hunger, with the anti-poverty community there in D.C. and work really well together to help get out the message about poverty. But truthfully, I would love to see some of the dialogue about hunger address a gaping hole in the anti-poverty safety net in TANF. What we're finding here in California is that TANF benefits are so low, temporary aid to needy families, or what we call CalWORKs, they're so low that even when we cut the benefits in CalWORKs, the food stamp allotment doesn't go up because they're already at a maximum. So anti-hunger advocates here in California have seen that. They know that every cut to a CalWORKs or a TANF benefit will impact the food economy of that household. Here in California, about 1 million kids, and they are leaders in the fight to save our CalWORKs program, our TANF program in the state. So it's not necessarily my experience that they're absent. Perhaps they haven't been invited to the table as much as we should, and I encourage us as leaders in anti-poverty work to reach out to them and find ways to work together.
Thank you, Jessica. Maybe related to that, does anyone else have any comments on ways that food banks may be connecting with the local food movement?
Definitely, just to comment, and I think over the past, just from some of the work that we've done in different states, we have started to see some food banks really being innovative about finding ways to get involved, and I think what it really takes some leadership at the food banks. I mean, they're incredibly, consumed with getting the food and getting it out into the pantries. They're doing an amazing task of doing that, and I think we've seen some food banks that are starting to realize, well, we have access to, all this equipment for transporting food. Why can't we now use that equipment to actually play a role in the local food system and help growers get their food to, farm to school or farm to institution programs? In many places, aggregation and distribution of local food in order to reach a broader local or regional market is a real problem. So, and I think there's been some work at food banks as well to start thinking more about making sure that they are serving appropriate food for people who might have, dietary problems or diet-related diseases. So I think, I've seen some promising stuff in the South and in Alabama with some food banks that we have talked to there, and we're involved with the efforts with Bristol Myers Squibb Foundation, which is a big program on diabetes, and they've been really working with some food banks around changing, having some protocol in place to improve the food and make sure it goes to the appropriate audience. So I think there's been promising things, and it's probably also, again, going back to your regional levels and really connecting the dots and making sure that the people who care about food and might be looking at it from different perspectives are working together to find the points of intersection and joint solutions.
Yeah, thank you, Emily. I have to put in just a little plug here for our local community group here in Fayetteville. We've organized an opportunity where at the farmers market, there's a direct connection between our farmers market and the food bank, so that surplus food after the farmers market, or actually on a specific percentage grant program, farmers can get that food into our food banks and then available for the low-income community. Dan, we're getting a number of questions here that I think you might want to respond to as well. Some of these involve the broader perspective, not specifically local food, but the issue of choice and access. One here, if SNAP participants make healthier choices than the general public, then why are anti-hunger groups opposed to making public the actual expenditures of SNAP participants?
Well, yeah, let me say I didn't say they make healthier choices. I said that the research shows that they don't purchase non-nutritious foods at any greater rate than the general population. So at any rate, I think in the current environment that we're facing, we're looking at huge funding cuts being proposed in the Ryan budget and in the House in general, huge cuts to the SNAP program. Certainly fundamental changes to the structure of the program by converting it to a block grant, which would cause the program to dwindle in the future. And I think the kind of data about individualized purchases can and will be misused by the demagogues who want to accomplish these policy ends. So I think if you believe that reducing SNAP benefits will increase hunger, and clearly it will, I think it's really kind of irresponsible to feed these attacks on the SNAP program in this way.
And this is Jessica too. I'd like to. This is Jessica. I'd like to jump in as well and just point out that the research does show that among low-income Californians or Americans, among low-income Americans, when a family receives SNAP benefits, the health of their purchases increases, and that's because they have more options. They have more money to spend on their food budget. If the real goal is to improve the health and well-being of low-income people, what we'd love to see is, instead of kind of attacking the choices that low-income people may or may not be making, and pursue policies that invade their privacies in ways that really are inconsistent with the way Americans feel about privacy. Rather than pursuing those policies, we would hope that people come to the table and support policies that we know work, which are to increase the amount of money or food budget that people have available to them. Right now we know through research done by Feeding America every couple of years that food stamp recipients, SNAP recipients run out of money, run out of food stamp benefits by the end of the month. That last week of the month, their choices are nil unless they've spent very frugally on their food budget. We would love to see the amount of benefits be more consistent with the amount of money that the American medical leaders and researchers say is necessary to have a heart-healthy diet. We know that that can be done, and it is expensive and it costs money, but that's why we need people from the public health community joining us in that effort to increase the amount of SNAP allotments rather than attack the choices of low-income people, which spread very far beyond the food dialogue itself.
We've had a couple of comments that have come in that I will mention, but it's always nice to share good news. Oregon Food is leading the way in Oregon, says one of our listeners, in making connections between local food systems, food banks, and the anti-hunger movement. Similarly, we've got someone from Washington saying that there's a lot of very innovative ways of linking farmers markets, the local food movement, and the anti-hunger movement out there. So that's always good to hear good news. One of the questions that came in that takes us in a little bit different direction, but that I think we might have some interesting comments on. Can someone speak to the differences between rural and urban communities in terms of food banks and hunger issues?
This is Emily. I'm happy to speak about that a little bit. Yeah, as was mentioned,
Yeah, go ahead, Emily. You can go first, and then if anyone wants to join in, they can follow.
Okay. As Susan and Michelle mentioned, we do a lot of work in sort of in the South, in Mississippi and surrounding states, and my work in the field around the food policy, food law and policy field have really started in those areas, and I think it's been a real change to start to see there's some of the same problems, but I think there are a lot of issues in rural areas that are really intractable, and we really need to be thinking of good solutions to them. And I think one of the big things we've seen lately around increasing access to food is if you start to build these farmers markets and more grocery stores and use things like fresh food financing or kind of financial and zoning incentives to get more grocery stores in urban food deserts, the thought is that once they're there, they'll be able to make ends meet. But this is really a challenge in rural areas because there's just not enough of a market in some of those places. So you've seen a lot of retailers shutting down, even with pulling together a farmer's market, which generally can be at lower cost to start because you don't need to invest in a building and all the equipment. It's really hard for them to stay afloat, and I think we've been trying to come up with some creative solutions. As we start seeing rises in fuel prices, et cetera, I think we'll start to see that some of these rural access issues will grow even more because it's just becoming inefficient for people to be driving around to get to their food and for people to be having to order food in these shipments on their own. So we're thinking about some creative ways to tackle that, but I think it's something that is ignored a lot in the dialogue. I think there's a lot of talk about kind of urban areas and urban food deserts, and even with things like SNAP, the people that tend to, the legislators that tend to really support it and get on board with it happen to be from the states where there's big urban poor populations, and I think we need to really kind of find ways to connect those two, the two areas and know the similarities but also be cognizant of the differences, because I think there's some challenge in rural areas that are just, we haven't really found solutions that work yet.
Jessica, did you have some comments on that as well?
No, I mean, I think just to say that I think it's an important thing to point out, and not only within food banks or emergency food programs, pantries, soup kitchens, etc., but also around what it means, what local food means in different parts of the country, right? In California, it's a different place, and you can grow, almost anything by dropping a seed in the soil. There are many parts of the country where most of the year you can't grow anything, and where food has to be coming from other places. And so just to put out there a question about what does local food mean in those communities, not that I have an answer, but I think just to validate the question.
Well, I know that the panelists have been seeing some of the questions coming in. Is there anything that you would like to address specifically that I'm not picking up on here yet?
This is Dan. There's some questions around the third point about bans on non-nutritious foods, and a couple things I'll try to respond to. One is the question of why can't SNAP benefits be limited to nutritious foods. And I think one answer to that is that it's just very hard to define what that means. And I think that most nutritionists would say there's no such thing as a nutritious food, it's a nutritious diet. And you wind up making these kind of silly distinctions. For example, Minnesota several years ago applied for a waiver to ban soda and candy, ban purchases of soda and candy, which was denied. And chocolate bars were banned, but Kit Kats were okay because they had some wheat in them. And this is what happens. Even if you're talking about just a soda ban, actually the New York proposal was to ban sugar-sweetened beverages. Well, does that mean Gatorade, Ensure, vitamin water? It's very difficult to and I would say probably impossible to draw those kinds of distinctions in a way that makes sense. The other thing is the question about, just a question about, really along the same lines about barring soda. And I think there's a difference between, generally saying, making soda illegal, can't be sold. I mean, I'm sure there's would be all kinds of problems with that. It'll never happen. But, that's a different issue than whether we should single out SNAP participants, whether it's fair to do that, whether we should impose the stigma by doing that, the implementation problems with the SNAP program, which of course wouldn't exist if there was no soda being sold anywhere. So, a lot of our objections to these proposed bans are because they are limited to SNAP participants. Maybe that's where we probably part company with the beverage industry. But that's what the concern is.
Thank you, Dan. Here was a question that came in specifically for Emily. Can you share, just lost it here. Can you share examples of the living wages that might be associated with economic development and the local food movement?
Yeah, sure. I mean, I think, what we've seen really, if you look at the food system along the sort of all the elements of the food system, including everything from growing the food and having these sort of small farms where there's more labor needed. I mean, what we've seen particularly in the South is in the past, farms needed a lot of labor, and now they do everything with a few people and a lot of machines. But if these sort of urban farms or, kind of farms on the city perimeter that are growing a wider range of foods and growing fruits and vegetables that often need more manpower do create jobs for people. And I know it's really hard work and it's not for everyone, but they're at least providing more opportunities. And going down that chain around food processing is a big area as well. One of the things we've worked on a lot is around when farmers first are just growing sort of fruits and vegetables and selling them directly. That's really great, and of course those are the healthiest way to consume those foods. But it is sometimes hard for them to make ends meet if they're a small operation. So being able to process those foods in some way, even things like cutting up vegetables or like apples or lettuce or whatever, and selling them, for example, to farm-to-school programs, they're going to be able to get in the door more quickly because it takes some of the work out of the institution. And there are a lot of jobs in doing that, and we've seen a lot of growth in small processing facilities, things like regional food hubs where we're trying to bring together under one roof all these elements of processing, grading, aggregation, and distribution. One thing we've worked on a lot is around what's called cottage food production or in-home food processing. So there's a lot of ways you can process food and, very basic processing that's very low risk. And I think over the past few years, we've seen a huge growth in the number of states that now allow this. And it means that people don't have to go out and build a whole new certified, inspected, special fitted kitchen for that. But these things that are really low risk, they can do in their home kitchen, and it really brings more money home for them. And I think the other thing to say as well is that we've seen, there's been several studies on this. I can't recall an exact data off the top of my head, but there's been a lot of data on the multiplier effect of local food systems, both just in sales like at farmers markets or directly to farmers, $1 of input leads to almost double that in terms of money that's created and kept in the community. Same thing with farm to school programs. When schools spend a certain amount of their money, there's a 2 or 3 time multiplier effect of money that stays in the system. And I think there's all these different outlets. I think some of it's being creative and for people to be able to be trained in those and to get your city, your state, your kind of county government, whoever's the closest proxy for where you live, to see investing in the food system and in food system infrastructure as investing in economic development. I mean, all governments, particularly right now, are really interested in finding ways to kickstart the economy and get more economic development. And I think investing some of that in the food system can really lead to more creation of wealth in local communities and creation of jobs. So just getting your government to get on board with that and see that as a means of economic development.
Yeah, great. A lot of good ideas there. One of the taking a little different twist on it, we've had some discussion of public assistance benefits and how that might play into our discussion. One of the questions that just came in was the question of how low-income people who are not eligible for public assistance benefits might benefit from local food or be affected by the local food movement.
This is Jessica, and I can try to take a start at answering that. First, I just want to point out from Emily's answer to the prior question that many of the things that she was pointing out were projects that really were based in finding the places where low-income people have assets. They might not be money assets, but low-income people have assets. Their ingenuity, their creativity, their hard work, perseverance, all of the things that you need, and you get to unfortunately practice quite a lot surviving in poverty, and in these days with so many people in deep poverty. And so in as much as we can encourage those kinds of solutions to problems within the food systems and within the broader economy, I think that's when we're going to be seeing success. And sometimes it is frustrating and it's slow work and it's not a big impact that some folks would like to see in a big change in national policy, but they are what are both respectful and successful. And just also to address a question that came in with regards to, it's kind of the opposite of that, with regards to whether or not staggering benefits allows, puts people in jeopardy when they make poor nutrition decisions. Again, kind of this focus on what people perceive as being the lack of skills of low-income people, and really rather than the many skills that low-income communities do have. So I just want to continue to keep us focused on that. With regards to families that aren't, or individuals that aren't eligible for public nutrition programs like food stamps or SNAP, there are food bank programs that serve them, that serves people who aren't eligible for SNAP. Unfortunately, in those settings, though, they don't have choice. People, community members, don't have choice for the most part about the food that they're served at a soup kitchen or food pantry. Those are products that are purchased for them on their behalf, and more these days with a real attention to special needs they may have, or the broader health of the low-income community. But those funds, just like the funds of all the safety net programs nationally and within states, are being jeopardized by budget cuts, by austerity measures, and by our inability to focus on a bigger picture of reducing inequality. And unfortunately, a lot of those families, they are going without food. It can't be that growing a garden in their front yard, likely they don't have one, or on their back patio in their apartment, likely there's a rule against doing that. It can't be that those are the only solutions, though, and we do need to find better ways to help families meet the food needs that they have here in what's going to be a long road to economic recovery in the U.S.
Thank you. These have just been great answers, and we continue to get a number of wonderful questions in. I'm hoping that some of the resources that we have up on the website will help people to continue this discussion. Michelle?
Yes, I'd like to thank Professor Schneider and our panelists, as well as all of you for joining us today. And as Professor Schneider said, on our website that you will be mailed a link to after this broadcast, you will get a link to some background resources, our panelists' biographies, and a recording of the webinar. And the resources are everything from websites to the kinds of data that people have been asking for during this discussion, and articles, things that will really help you to move forward on these issues. And please look for the special issue of Clearinghouse Review in print and online in October. That will also contain a lot of resources on this topic that can help you move your practice forward. Again, thank you so much for joining us today, and goodbye.